Hi everybody, once again Dr. Salim is here with you guys. Let's talk about color Doppler or Doppler shift. Let's talk a little more in explanation. Let's talk about better understanding of color Doppler. For example, look at these colors. You can see these red colors, and then let's follow, because this will be an easy example for the colors of the flowers. I mean, this is nice flowers, so I think I will be like kind of a practical example. So we have for imaging, for ultrasound, we all know for the ultrasound images, actually we have to take some color Doppler pictures for diagnostic purposes. So now we have color Doppler for 4 purposes. We use color Doppler. Do not forget, number one, we want to see if there is a flow or no. So for the presence or absence of the flow, is there a flow or no? And also we can see for the velocity of the flow. It will give you just simply, we can say, a mean velocity of the blood flow in a vessel. And also we are trying to, okay, so again I will just repeat it one more time. So we use the color Doppler for 4 purposes. The presence of the flow, I mean there is a flow or there is no flow, so we're just looking for that. And then we're looking for the velocity of the flow. We are actually looking for the mean velocity, average velocity of the flow. And the third thing is the direction of the flow, like which way the flow is going. So we are talking about that. And the fourth one will be the nature of the flow. Is it a normal laminar flow, or is it a turbulence flow? Is it normal flow or abnormal? Is it normal healthy flow, or is it something like post-stenotic flow or somewhere pathology flow? So these are the things. Now the question is how we diagnose these things, like what is the mechanism behind these flow or these directions or these different colors. Sometimes we have red color, sometimes we have blue color, and sometimes we have a mix of the color. For example, look at these flowers. Look here. So you can see the red color you see here. That's like a completely red color. I mean, this is the flowers are available right now, so that's why I'm just giving the example. And also you can see the other flower, which is purple, but pretended it is the blue color. I mean, it's a different color, that's what I mean. So now these two are totally different colors. What we have, it is the difference between the reception frequency and the operating frequency. For example, look at this flower. So this one and this one, they have totally different colors, correct? So for example, pretended, if we bring, like if we do operating frequency, if you're using any probe with, for example, 7 megahertz, now we're looking to the difference of the reception, like how much is the difference, because your operating frequency for the transducer, that is known, that is constant, that's not changing. Only the difference or the change you will see in the reception. So for this reason, if we get more reflection, we get more from the transmission, like whatever you use. For example, you're using 7 megahertz transducer and you get 7.1 megahertz, like you get more reflection, extra reflection, you get extra frequencies. So it means you are having positive Doppler shift. And then in case if you're using that 7 megahertz but you get less reflections, for example less than 7 megahertz, 6.9 megahertz pretended that way, then it means you're getting a less reflection compared to the transmission. In that case, we will have less reflection, and that will be a negative Doppler shift. I will tell my friend to take some more pictures of these flowers while I'm just explaining these things to you guys. So now the main thing is the difference between the two frequencies, the operating frequency and the reception. So it is a very tiny difference between the and in now if the flow is going towards the probe, where your probe is, and it's going towards the probe, it means you have a positive Doppler shift, because the flow and pulses from the transducer, they are totally on opposite direction of each other. But if the flow, any kind of flow, it can be blood, it can be urine, it can be anything, but the flow, if the flow and pulses of the transducers are opposite direction of each other, this will create more reflection, and that will be a positive Doppler shift. But if the flow and pulses of the transducer are in the same direction, doesn't matter, they are going away or one, like they are on the same direction, they go to same direction, that will give you less reflection, and that will give you negative Doppler shift. So internationally, two colors are accepted for color Doppler, one red and one blue. I mean, color has no really big meaning here. It's all just about the reception frequency. So somebody may ask you that question again, that which frequency select the Doppler shift? Is it reflecting frequency, or is it transmitted frequency? So keep in mind, transmitted frequency is constant, they are not changing, only the change will be in the reflection frequency. If I get more reflection from transmitted frequency, it will be a positive Doppler shift. It means the flow is coming towards the transducer. And then if I get less frequency from the reflection, it means that will be a negative Doppler shift, and that will be like we can say the flow is going away from the transducer. So in this case, for example, if you are scanning hepatic veins, so on the hepatic veins, we know the pulses are going deeper towards the IVC, and the flow of the hepatic veins are also going towards the IVC. So they go in the same direction. In this case, our reflection from these RBCs will be less. That will be less than operating frequency. So on that case, you will get negative Doppler shift, and the veins will look like in a blue color. So again, the color is not a big deal. That's not a matter. The thing is how much we get the reflection, more or less from operating frequency. So as you know, we have a formula for the color Doppler shift. It's a reflective frequency minus operating frequency. So the dominant thing here is reflecting frequency. So do not forget, this is all the concept behind the color Doppler. So very important for all of us to know that what is a negative Doppler shift and what is a positive Doppler shift. And one more thing, remember, it's not about the RBC, it's not about the blood, it's about the flow. Because when we are looking for urinary bladder, we also turn on our color Doppler and we see the urinary jets, they are red. Because the urinary jets, they are coming towards the transducer, and the probe create pulses towards the flow, and the flow of urine and also the pulses, they go against each other, the direction are against, and we get more reflection on that. So this way the urine look red. So keep in mind, just in case if somebody asks you, sometimes we get mix of colors, blue and red are mixed together, and that is a case where the flow is going to all direction, because it's going towards in a way, it's going towards in a way, so it's the mixture of the direction of the flow actually. So we get on the same spot, we get positive shift, we get negative Doppler shift. A good example of this will be post-stenotic flow in that case. So I will tell my cameraman if that person can also take some more pictures from different areas. For example, just look to this color. This is two colors, correct? You see the two colors mixing. So the mixed color is a good example of actually we can say turbulence flow. That is a diagnostic flow for post-stenotic. So these colors, different colors, will give me different information for the color Doppler flow. When we're taking color Doppler flow, these will be a good information. Just in case, let's clear our concept regarding the color Doppler, why we use the color Doppler, why we have two different colors, why we have mixed color, and what are they for, like what are the diagnoses, when we can put a good diagnosis for something if we are looking to. So these are some information. I believe it will help a lot. And let's see, if you have any question, please do not forget to share all these information with all those healthcare providers who work in the radiology department, especially if they put their diagnosis on the probe, or we can say on the pictures, images. So these may helpful for them. And please do not hesitate if you think we need some more explanation regarding color Doppler. So let me know. I will try my best to explain it maybe more simple than this what right now we have. And please share the YouTube channel with all those healthcare providers you think they need these kind of information. So thanks a lot for listening all these information. Once again, I'm trying my best to explain these images or these sonographic principles, which can be helpful because the mechanism is important. When we know the mechanism of something, then it helps a lot. And in the last, now somebody may ask you this question, that what is the best Doppler angle? Like I mentioned that before too. So the best Doppler angle is 0 angle, because that gives you 100% Doppler shift. And the worst Doppler angle is 90 degree, sorry. So 90 degree, we have cosine of 90 is 0, and there is no Doppler shift detected. Please do not forget. Take care.